Welcome back. In the previous video, we discussed the structure of the human vocal apparatus and introduced the concept of the International Phonetic Alphabet used to record the exact pronunciation of sounds, regardless of the spelling rules or a particular writing system used in the language to which these sounds belong. In this lecture, we will focus on the description of consonants typical of North American English and most common to North American dialects. A consonant is a basic sound that is produced with some kind of obstruction to the airflow in the vocal tract. This obstruction modifies the sound that our breath produces when escaping our lungs. Each consonant can be described using three criteria. The first criterion is voicing. It depends on whether our vocal cords vibrate or do not vibrate when the air escapes through them. The second criterion is the place of articulation. Put very simply, this is a place in the vocal tract where the obstruction to the airflow is happening, and it can be anywhere from the glottis to the lips. The third criterion is manner of articulation. It refers to the type of obstruction created in the vocal tract, whether the obstruction is complete or partial, and if partial, to what degree. These three criteria are reflected in how the sounds are organized in the IPA chart. Look at this IPA chart, modified to include only the consonants of North American English. As you can see, some squares are blank, which means that English does not have consonants that fit the descriptions in those squares. But some squares contain two sounds. Where the sound appears on the left side of the square, it is voiceless, and the sound on the right is voiced. At the top of the chart are different places of articulation, from bilabial to glottal. And at the left side of the chart, the manners of articulation are listed, from plosive to approximate. Let us locate the sounds S and Z on the chart. They appear at the intersection of alveolar and fricative, which means that the airflow was obstructed at the alveolar ridge, and the sounds are both produced in the fricative manner, with S on the left being voiceless and Z on the right voiced. Next, we will discuss what each place and manner of articulation mean. Let's start at the very front of our vocal tract. There are 5 sounds we produce with our lips either pressed or brought close together. P, B, M, W, and W. The symbols for P, B, M, and W, as in were, are the same as the Roman letters we use to encode these sounds in writing. The upside-down W is the symbol for the sound Wh, as in where. But a lot of you probably don't have this sound in your phonetic repertoire. This sound is slowly disappearing from North American English, so it is possible that your grandparents may distinguish between words like where and where did you go, and where, as in what shirt did you wear, but you may not distinguish them. Next come labiodentals. There are 2 labiodental sounds in English, F and V. They are produced with upper teeth touching the lower lip. The symbols for them are the same as the regular Roman letters. Going further in, we have dental sounds, Th and The. We produce these sounds by placing our tongue at the upper teeth or between the upper and lower teeth. This is why they're also sometimes called interdental, as in between the teeth. The symbols for these sounds are probably not familiar to you. The first one, voiceless, is theta. Theta represents the same sound as you hear in the word thick. The symbol for the voiced sound is called L. It represents the first sound in the word this. Next, we have alveolar sounds. There are a lot of them in English. T, D, S, Z, N, L, R, and a flap. To produce these sounds, we bring our tongue close to or in complete contact with the alveolar ridge. For many speakers, the tongue also curls a little bit back when they produce the sound R, as in round. And that is why we call this sound retroflex, literally curled back. There's a quick trick to see if you produce your R's as retroflex or not. If you take a toothpick and gently touch your tongue with it as you produce the sound R, you will feel a slight poke. if the toothpick pokes you in the tip of the tongue, your R is not retroflex. But if it pokes you in the underside of your tongue, it is retroflex. You're now looking at post-alveolars. The four symbols that you see in front of you are probably not familiar, except in mathematics. At least the first sound, the symbol for the sound sh as in shoe, is the same as the mathematical symbol for integral. The voice counterpart of this sound is zh, which cannot occur in English at the beginning of words. But we do have it in the middle, in words like pleasure, and at the end in words like mirage. Below sh and zh, you see double symbols, as if t combined with sh and d combined with j. That's exactly what it is. The voiceless symbol represents the sound ch as in church, and the voiced one the sound j as in judge. When we bring the tongue close to or in contact with a hard palate, the sound is called palatal. There's only one palatal sound in English, y as in yellow. Please note that the letter J in written English usually represents a very different sound, the sound j. But the phonetic symbol represents the sound we spell in regular spelling with the letter Y. Remember, the letter J in phonetics represents the sound y as in yellow. As we continue further into the vocal tract, the next place of articulation in English is velum. The tongue comes in contact with a soft palate, allowing us to produce the sounds k, g, and ng as at the end of ring. These sounds are called velar. Glottal sounds are produced in the glottis. In English, we have two of them. The one that looks like a strange question mark is called a glottal stop. It's sort of like a catch in the throat in the middle of the word The other sound is h as in hat, and the symbol for it is rather self-evident. Now let's look at the different manners in which sounds can be articulated. As a reminder, the manner of articulation describes how complete the obstruction to the airflow is. The most complete obstruction occurs when the tongue or another active articulator, like lips, comes in complete contact with a passive articulator and stops the airflow. The air then breaks through with a burst called plosion. Because the air is first stopped, these sounds are sometimes called stops. Because of the plosive release, the sounds are called plosives. In this course, you can either use the term stop or the term plosive, as you wish. But not all stops are released with a plosion. If the airflow is obstructed in the oral cavity, at the lips, alveolar ridge, or the velum itself can be lowered and then the air escapes through the nose. Such sounds are called nasal stops, or simply nasals. Now say the word letter and pay attention to what your tongue does in the middle of this word to produce the sound that in writing is represented with a double letter T. It's not exactly a plosive, is it? Your tongue doesn't so much block the airflow as gently and very quickly taps the alveolar ridge. It is definitely not the same sound as you would have produced if you articulated the word very slowly, letter. This sound, the one we produce in the middle of the words like letter and butter normally, is called a flap or a tap. But the tongue does not have to come into complete contact with any passive articulators at all in your mouth. Sometimes it comes close to them, but leaves a tiny narrow channel. The air escapes through this channel with a hiss, as in the sounds f, v, th, th, s, z, sh, zh, and h. The term for this rush of air is frication, and that is why the sounds produced with it are called fricative. Two sounds in English are essentially combinations of a very quick stop with a very quick fricative, which is reflected in the symbols we use to represent them. These sounds, ch and j, are called affricates. The final manner of articulation is approximant. Approximants are consonants produced with such a wide opening between the active articulator, the tongue or the lips, and the passive articulator that the air escapes without any hiss. There are two types of approximants. The ones with a somewhat smaller opening are called liquids. The retroflex liquid is the sound r, as in round, and the lateral liquid is ol, as in the word loud. Ol is marked in your chart simply as a lateral approximant. The term lateral refers to the fact that the air escapes the oral cavity on the sides of the tongue. W and y are called glides or semivowels. The opening is so wide that the two sounds occupy a middle position between vowels and consonants on the sonority scale. Traditionally, though, they've been classed with consonants, and that is why we include them in this portion of the lecture. The final criterion for the description of consonants is voicing. When your vocal cords are open, the air escapes through them very quietly, so the sound is voiceless. However, if the vocal cords are pressed together and tensed, the air breaking through them makes them vibrate, just like the strings on a guitar or a violin. This produces a sound wave that makes the sound voiced. Most stops, affricates, and fricatives in English have both voiced and voiceless counterparts. But nasals, approximants, and the one and only flap are always voiced in English, although not necessarily in other languages. Now let's do a little practice. Take a piece of paper and a pen. I will give you 3 words. After each word, I will pause, and you can also pause the lecture, and you will pronounce the word, paying close attention to what your speech organs are doing when you say it. Especially focus on the first sound in the word. Then take a pen and write down the IPA symbol for that first sound, and then write a phonetic description of it. Is the sound voiced or voiceless? What is the place of articulation? In other words, where is the airflow obstructed? What is the manner of articulation? Is the airflow blocked completely or partially? Does it escape with a hiss or without? Ready, set, go. The first word is banana. The symbol for this sound is the Roman letter B, lowercase please, and the sound is a voiced bilabial plosive, or stop. Now the second word, photo. The first sound is f, and even though we spell it with a PH, the symbol for the sound is the Roman letter F, and the sound is a voiceless labiodental fricative. The last word is thunder. That one probably took you a little while. The first consonant, th, is represented by the Greek letter theta, and it is a voiceless dental fricative. Well done! Now let's move on to the discussion of North American vowels.